there, my friends. This is Megan here with Core 3 Harmony and Wellness Services. I am so very grateful to have you here today. Thank you so much for checking out what we have to share today. Kicking off this February, we are going to be talking about heart health. And I am excited because heart health is a very, very important topic, and sometimes perhaps we don't spend as much time there as we possibly should. So in the United States, it is amongst many different commemorations for the month, it is considered what we call Heart Health Month. And for today, I'm going to be discussing specifically physical ways in which we can maintain heart health, as well as next week I'll be covering the emotional aspects of how to maintain good heart health. So for today, adjusting my microphone. For today, we will just dive in specifically with the how we can have and develop physical heart health. Before I dive into the topic, like I said, my name is Megan. I am the founder and creator of Core 3 Harmony and Wellness Services. Here at Core 3, we provide services in 3 areas. That is music therapy, counseling, and coaching. We are able to provide our services virtually, remotely, as well as in person if you happen to be in and around our office location area. Please know that we do offer a complimentary consultation to assess and see if we are a good fit for your needs. So if you are interested in any of our services, please do indeed reach out to us via email or phone. We have our information in the link below in the description box. If you are a subscriber, thank you so very much for subscribing. I very much so appreciate you. And if you are not a subscriber, please do so. It is the goal for us to go live every Monday. Okay, that is our goal, to go live every Monday. I wanted to share and say that if I'm not able to go live, I try to do the best that I can to upload information for you a little bit ahead of time if something happens to occur where I am not able to be in front of you live as I am right now. But I enjoy it. It's a little bit more spontaneous. I have, things set up and ready to go to discuss, so I'm not just here all willy-nilly. But if you're not a subscriber, please do subscribe. Our goal and our hope is to continue to grow this channel, to continue to provide a space where we provide content that is uplifting, informative, and inspiring you along your life journey to show up and be the best you possible in every way. So today I wanted to discuss with you specifically some signs and ways in which we can start to discover what is going on with our heart health. I know many of us are aware of perhaps maybe some signs and symptoms of a heart disease and maybe even stroke. For those of us in the healthcare field and profession, we are taught some of the signs and symptoms of perhaps when someone could indeed be having a stroke and or heart attack. But heart disease is what I like to call something for many of us that can be a silent killer in a sense, because we may not be very aware of it. So I'm going to share with you some information that I collected directly from the Cleveland Clinic regarding how to have and develop better cardiovascular health. Okay, so first and foremost, I just want to discuss the disease risk factors. And some of these, when you hear of them, you may not think of heart disease, but this is, I want to say, underneath the surface of some of these conditions that you may be familiar with. So check this out. Cardiovascular disease risk factors include high blood pressure, high cholesterol, tobacco use, diabetes, family history of heart disease, sedentary lifestyle or obesity, diets high in sodium, sugars, and fats, overuse of alcohol, preeclampsia or toxemia, gestational diabetes, chronic inflammatory or autoimmune conditions, and chronic kidney disease. Okay, so those are some cardiovascular disease risk factors. Now, if you know and aware that you have any of these or that they run in your family, it's going to be really important that you listen in to specific ways and how to alleviate some of these conditions and to be able to monitor what is going on with yourself to understand what it is that you need to do, how you can adjust your lifestyle and your eating habits, okay? All right, so what is heart disease? Cardiovascular disease, also referred to as heart disease, is a group of diseases that affect our heart and our blood vessels in our body. These diseases can affect one or many parts of our hearts and our blood vessels. As a person may be symptomatic, that is, physically experience the disease, or be asymptomatic, not feeling anything at all, and yet still have it. Heart disease includes heart and blood vessel problem types that can include abnormal heart rhythm, heart valve disease, narrowing of blood vessels in your heart or other organs throughout your body with plaque, heart squeezing or relaxation difficulties, heart and blood vessel problems that one could be born with, and problems with your heart's outer lining. Okay, now the following are conditions that are included in cardiovascular disease, okay? Arrhythmia, that is a problem with the electrical conduction system of your heart, which can lead to abnormal heart rhythms or heart rates. Valve disease, problems with your heart valves structure that allow blood flow from one chamber to another, such as either the tightening or leaking of the valves. Coronary artery disease, problems with blood vessels of your heart, such as blockages. Heart failure, problem with heart pumping, relaxing functions, which can lead to fluid buildup and shortness of breath. Peripheral artery disease, this is a problem with the blood vessels of your arms and your legs and abdominal organs, such as narrowing or blockages. Aortic disease, which is problem with the large blood vessels that directs blood from your heart to your brain and the rest of your body, such as dilation or aneurysm. Congenital heart disease, heart problems that you're born with, which can affect different parts of the heart. And pericardial disease, which is problems with the lining of your heart, including pericarditis and pericardial effusion. Okay. Cerebrovascular disease, problem with the blood vessels that deliver blood to your brain, such as narrowing or blockages, and deep vein thrombosis, blockages in the veins, vessels that bring blood back from your brain and body to your heart. So now, how common is heart disease? Cardiovascular disease is the leading cause of death around the world. Let me say that again. Cardiovascular disease is the leading cause of death around the world and in the US. Every year, 655,000 people in the United States die of heart disease. Almost half of adults in the US have some form of cardiovascular disease. It affects men and women. In fact, 1 in 3 women die from cardiovascular disease. It affects people of all ages, ethnicities, and socioeconomic levels. If that isn't enough to wake you up, I don't know what is. We need to get connected to our heart health for sure. Okay, I'm going to keep going. So what causes heart disease? The cause of cardiovascular disease can vary depending on specific types of cardiovascular diseases that I just mentioned earlier. For example, atherosclerosis is plaque buildup in the artery, causing coronary artery disease and peripheral artery disease. Coronary artery disease is scarring of the heart muscle, genetic problems or medications that can cause arrhythmias. Aging, infections, and rheumatic diseases can also cause valve disease. And I had mentioned to you first off the cardiovascular disease risk factors, okay? I'm gonna do the best I can to try to include some of this. I'm gonna also be writing a blog post about obtaining heart health, and I will include the cardiovascular disease risk factors in the blog. So be on the lookout for that this week, okay, on our website. So what are the symptoms of heart disease? Some symptoms of abnormal heart rhythms can include pounding or racing of heart. So that's where some people say heart palpitations, chest pain, sweating, lightheadedness, and shortness of breath. Symptoms of heart valve disease. Okay, so that what I just read was symptoms of abnormal heart rhythm. Now these are symptoms of heart valve disease: dizziness, tiredness, chest pain, heart murmur, and shortness of breath. Symptoms of blockages in the blood vessels of your heart or other organs or throughout your body may include, listen to these: pain in your chest and upper body, neck pain, heartburn or indigestion, exhaustion, shortness of breath, nausea or vomiting, and dizziness. And those are all symptoms of blockages in the blood vessels in your heart or other organs throughout your body. Symptoms of heart pumping difficulties can include swelling in your lower body, exhaustion, shortness of breath. So when I've worked with individuals in higher levels of care, and I often would see the signs of edema, the swelling of the legs and the feet, okay? And those individuals, sure enough, did indeed have some cardiovascular disease happening. Heart problems that you are born with can include the following: heart murmur, inability to handle exercise, and shortness of breath. Problems with your heart's lining may give you symptoms that include chest pain, typically sharp or worse with deep breathing, exhaustion, difficulty breathing, swelling in your lower body. It's important to note that women or older adults may have more subtle symptoms, but still have very serious cardiovascular disease. So, any of these symptoms popping up for you or that you've noticed, I definitely recommend you reaching out with your primary physician to get some of these things checked. And before time is up here, I'm going to go over with specific things and how you can do that. Diagnosis and tests, okay? So how is cardiovascular disease diagnosed? Your healthcare provider performs a physical exam and will ask questions about your symptoms that I just shared with you earlier, personal health or family history. They can also order some tests to help diagnose cardiovascular disease as they are appropriate. And I'm going to be going into those now. On our website, core3tx.com, specifically in my coaching program for those individuals seeking coaching for their health and wellness, it is very important that they get blood work, lab work done. And that's part of our program's process, is that I like anyone that is signing up to do health and wellness coaching with us here at Core 3 to get labs done and routinely throughout our coaching time together, because we are able to understand better what the body is doing, how it's interacting with the lifestyle changes and adjustments you may be making through, and indeed taking a look at your lipids and your labs, okay? So here's some things and common tests that can help with that. If you do not have a lab or someone that you're working with, I have been trained to take a look at and assess upon you being open and willing to share your lab results with me, what things to look at, or what tests or labs to seek out to help you understand what's going on. And so on our website, we have worked with Your Lab Works. And let me see if I am actually able to pull that up right now to just show you, okay? Sometimes it's easier to to see it as opposed to so there's a tab I have on our website called Your Key to Better Health Labs. Okay, so let me see if I can share my screen with you and keep everything together and not lose you. Don't want to do that. Let me share. Okay, so I hope that you can see this. Here on the website, this is called, it's a title, I have it, Unlock Your Biological Data. Okay, and we have partnered with Your Lab Work. And so there's a link there where you can go to our site, and we receive a little bit of a commission for you just checking it out and using our link if you choose to get your lab works done there. Let me see. I don't think I'm sharing, so hold on. There we go. You're probably like, oh, you can't see it. Okay, hopefully you can see it now. So here we have where there's the link there. You can go there and click on that, and it'll take you to a company called Your Lab Works. And let me just go there now and see if it will continue to follow me there, or if I have to adjust. Let's see, I believe, let me share this tab. Let me see if this is working. Great, you can see that. Okay. Sorry for switching back and forth. I can't, when I'm show my screen, I can't see that you can see what I'm showing. I can only see the screen, so I want to make sure it's presenting well for you. Okay, so this is the site, Your Lab Work, and I love it. You can get labs done directly. You can get the specific tests that you will like to take, and you'll see there's different options. You can get it delivered to your home, and it can be, you can look up where the closest labs are to your location, and you can get the lab work done there. Okay, so that is an option we have. That's a link on our website. Right now they have a thyroid panel awareness as well going on, so you can get some thyroid lab work done. That's a special happening right now, but I wanted to show that to you because let me go back. It's really important to get the lab works done that you need. So if you don't have that option where you're easily able to get to your doctors, or with the pandemic and all kind of stuff, it's kind of makes it puts a strain on you. You can choose the labs you want and have them delivered to your door, and have them also mailed to your closest lab to your location. And you can pull down on the website that I showed you, you can pull that information down, put in your zip code, and then it can help find a closest lab that will be able to work with you to get your labs done. Okay. So let me stop sharing. Let me go back to me here. Okay, so let's take a look at this. What are the tests? What are the labs that can be done? So blood work will measure the substance in the blood that indicates if there's cardiovascular health, such as cholesterol or any specific proteins. An EKG helps to record the electrical activity that is happening with your heart. Ambulatory monitoring, that's using wearable devices that can track your heart rhythm and rates. And so I don't have mine on, but many of us now have monitoring right on our wrists via our smart devices and through our phones. So that's another great way you can track it yourself and monitor it yourself. An echocardiogram, which uses sound waves to create an image of your heartbeat and blood flow. Cardiac CT will use x-rays to create images of your heart and blood vessels. Cardiac MRI, which uses magnets and radio waves to create images of your heart. Stress tests are also usable, uses different ways to stress the heart in a controlled way, through exercise or medications, to determine how your heart responds through EKGs or other images. And cardiac catheterization uses a catheter, thin hollow tube, to measure pressure and blood flow in your heart. Okay. So now, ways in which cardiovascular disease is treated. And if any of you watching this here are dealing with cardiovascular disease, I would love it if you could add in there, if you could, and share how you found out, what your symptoms are, and how it's being treated. Okay. That would be amazing to be able to have you share that if you could. So how we can manage it, okay? How can we treat our cardiovascular disease? So treatment plans can vary and depend on the symptoms and type of cardiovascular disease that you have. Treatments can include lifestyle change. Coaching is great for that. Examples can include changes and updates to your diet, increasing aerobic activity, and quitting smoking, releasing and quitting those habits that put stressors on your heart. Medications, your healthcare provider may prescribe medications to help control the cardiovascular disease. Medication type will depend on what kind of cardiovascular disease you have. Okay. Procedures and surgeries, if medications are not enough to manage your cardiovascular disease, your healthcare provider may use certain procedures or surgeries to treat this. Examples can include stents in the heart or leg arteries, minimally invasive heart surgery, open heart surgeries, ablations, or cardioversion. Cardiac rehabilitation. You may need a monitored exercise program that helps your heart to get stronger, and active surveillance. You may need careful monitoring over time without medications or procedures or surgeries. Okay. So, cardiac rehabilitation, how can it improve your treatment? It helps your heart to regain strength, helps to provide extra support to changing your lifestyle, involves nutritional counseling and monitored exercise. So, if you are feeling like you have kind of reached a stuck space, reach out to us and get a consultation for our health and wellness coaching program. And we can put together a plan that works for you based specifically on the goals that you need and areas that you're hoping to achieve. Okay. Your healthcare provider may recommend cardiac rehab if you need heart surgery. You may also qualify for rehab if you're recovering from a heart attack or stroke. Cardio rehab may also be a good choice if you're having trouble sticking to your cardiovascular disease treatment plan on your own. So you can seek out assistance from your provider to see if you qualify, specifically with a hospital-based program if you believe that's the best thing for you. Okay. Prevention. Ways to prevent heart disease. 1, avoid all tobacco products. 2, manage other health conditions such as diabetes, high cholesterol, and high blood pressure. Achieve and maintain a healthy weight. Eating a diet low in saturated fat and sodium. Exercise at least 30 to 60 minutes a day on most days if you can. And reduce and manage your stress. Okay. All right. So cardiovascular disease may increase your risk for other conditions such as heart attack, stroke, acute limb ischemia, sudden blockage of leg arteries, aortic dissection, and sudden cardiac death. Okay, so when should you reach out to your healthcare provider? You should reach out to your healthcare provider if you're experiencing or have had these things: chest pain, fainting, shortness of breath, especially if it's new or progressive, pain and numbness in your arms and legs, and ripping or tearing back pain. Okay, those are signs to immediately reach out to your primary healthcare provider. Okay. It is really important that we manage and learn what these symptoms are, which I shared, so that we can be able to recognize what's happening and actually start asking and inquiring and advocating for ourselves to get some of these labs done so that we can see what the underlying causes are. If you're having symptoms and it's ongoing and you're finding that you're not able to see what can help, I definitely recommend labs. Go to our website and click on Your Key to Better Health Labs and check it out. You can pull down the labs test tabs and pull down the different labs that are offered through the site, as well as finding locations of labs in your area that will be able to conduct the lab work for you and the lipid panels there. Okay. I so very much appreciate you. And I hope that this information that's shared today during American Heart Health Month helped to raise your awareness and to help you to stop and think, you know what, I really haven't done very much specifically for my heart health. And I think I definitely need to start doing that, especially, when you hear the data and the statistics that this is the #1 cause of death and illness is heart disease throughout the world, not just the United States. So definitely, if you have a history of it in your family as you're getting older, do monitor your heart health along and encompassing with other areas, other organs of your body. Your heart is very, very important. And the symptoms, I feel like they're kind of underlying, like we may um, not recognize it right away. And so the earlier we can start making adjustments to lifestyle and eating, the better. Okay. So I trust and believe that you've heard some information here today that have inform you, enlighten you, and will encourage you to step in and advocate for yourself and to start looking into your own heart health and what adjustments and changes you may need to take. Next week, we will dive into emotional heart health. And so I hope that you can tune in with me again next Monday at 11:30 a.m. Pacific time. Please do know that I am sending nothing but good vibes your way from my energy to yours, reaching out, wherever you may are, wherever you may be, whoever you are, I so greatly appreciate you. Please subscribe. Please give us a thumbs up. Please take some time out and to assess your own heart health. And if you've never done any kind of physical or follow-up with what that looks like, get some lab work done. Please know this, that you so very much, you matter, you are worthy, and you are oh so loved. I appreciate you. Thank you so much for listening in to what I have to say. Please tune in when we go live again next week and we discuss emotional heart health. Enjoy the rest of your week, and I am looking forward to sharing with you again.